Hello, my dear friends. A very important session for all exams. Very important images for forensic medicine we are going to discuss with few very important concepts also. So, these are going to be very important images. Now, before starting the images, just see two concepts. What is the most specific test for blood stain? That is spectroscopy. And for species identification, the best test is precipitin test. The best test for species identification, not only blood stain, for any species identification, it is precipitin test. Now, friends, we are coming to now the first blood stain test. We are going to discuss the blood stain test. The first blood stain test is Teachman test. And also we can remember it very easily. Teachman man. The man color is brown. We all know the color of the man is brown. So here we see brown rhombic crystal if we use Teachman reagent for blood stain. What are the two important Teachman reagent? One is sodium chloride and second is glacial acetic acid. So this is a very important test. You can get a brown rhombic crystal, that is a Teachman test. Now the second very important test for blood stain is Takayama. And my dear friend, in Takayama, we use three reagents. That is a GPS. That's a glucose, pyridine, and a sodium hydroxide. But my dear friend, how to see Takatak color? Which color is Takatak? If you see pink feathery crystal, your life becomes Takatak. So that's a trick. Teachman, the man has brown color, and pink feathery crystal is a Takatak color. So pinkish color is a Takatak color. So this is Takayama test for blood stain. Now, we have discussed two blood stain tests. Now the test for semen. For semen, we use a test that's a Florence test. This is Florence. And in Florence, we have C letter. So it identifies C for choline crystal. And we can remember by Kohli, Virat Kohli, choline Kohli. So it is a dark brown rhombic crystal. That is a Florence test for semen. So I discussed three tests. Teachman, man, brown rhombic crystal in blood stain. Takayama, Takatak, pink feathery crystal is Takatak. And Florence has C letter, that's a choline crystal it detects in semen. So Kohli ka color kya? It's a brown rhombic. We can remember by this trick only. So here in Florence, we use potassium iodide. The reagent used in Florence is potassium iodide. So it's a choline iodide crystals, which is brown rhombic crystal. So now the next very important test is Barberio's test. You can see Barberio's S for spermine crystal. It is spermine crystal. Florence detect choline crystal, Barberio's detect spermine crystal. And my dear friend, here it is yellow needle shaped crystal. You can see the picture, it is yellow needle shaped crystal. And my dear friend, it is spermine picrate. So friends, the next test is Barberio's. So Barberio's, you can see, my dear friend, that is Barberio's has S. It detects spermine crystal. And my dear friend, the color of spermine is yellow needle shaped crystal. And my dear friend, it forms spermine picrate. You can get a question that in which test we use picrate. That is a Barberio's test, picric acid. And the picric acid gives yellow needle shaped crystal. So I have discussed four tests, two for blood stain and two for semen. These are some very important MCQs asked in exam for different tests, my dear friends. Now, sir, what are the different type of postmortem incision? The most common incision is I shape. You can see the eye. Yes, this is the I shape. It is starting from chin to pubic symphysis. It is an I shape incision. Second incision, Y. So who used to say Y? भाई हमारे घरों में Y कौन कहता है? This is done by male or female. That is Y shape incision is done in female, my dear friend. It starts from acromion process from the both side, then comes in the midline, then it is pubic symphysis. So Y shape incision is done in female. Now, sir, modified Y shape. So this is modified Y shape. The third incision is modified Y shape. My dear friend, modified Y shape, M for modified, M for start from mastoid process, then suprasternal notch, then it's a straight line. So again, I'm revising all 3 points. The most common incision is I shape, acromion process, this one. Then Y shape, that is a very important incision, Y shape done in female. And M for modified, M for start from mastoid process, suprasternal notch, then it's a straight line. That is done in asphyxial death. So modified Y shape is done in asphyxial death. So these are three important MCQ. Most common incision I shape. In female, what we do Y shape, and modified Y shape done in asphyxial death. Now, sir, three type of pedestrian injury. You can get a question. This is the first impact. That is the primary impact injury. So if you are a pedestrian and you have first hit, that's a primary impact injury. In primary impact injury, there is a bumper fracture of tibia bone because it is hitting on the leg. So bumper fracture of tibia bone is seen in primary impact injury. Now secondary impact injury, like you are going over the glass or bonnet, that is a secondary impact injury. So first impact is primary impact. You are going over the glass or bonnet, secondary impact. Now, sir, my dear friends, you are hitting the ground. That is a tertiary impact. Friends, one question comes in exam. Tertiary impact is also known as secondary injury. Tertiary impact is also known as secondary injury. So multiple abrasion and tire mark are examples of tertiary impact. Three question. Bumper fracture, tibia fracture is a primary impact. Glass or bonnet injury is secondary impact, and hitting on the ground, that is a multiple abrasion or tire mark, are tertiary impact. But please be careful, my dear friends. Pakka dhyan rakhna, tertiary impact are also known as secondary injury. Sometimes they don't give the word tertiary impact, they give the word secondary injuries. Primary impact, secondary impact, tertiary impact, which is also known as secondary injuries. Yes. Now, sir, this is a frostbite, which is a hypothermia, and it is commonly seen on the nose, and here temperature is minus 2.5 degrees centigrade. It's a hypothermic condition, frostbite. We need rewarming. Now, sir, my dear friend, one condition which is hyperthermia and which is also known as LU. One condition which is a hyperthermia, which is also known as LU. This is the only hyperthermic condition where sweating is absent. And my dear friend, what are the other name of LU? That is a heat stroke or sunstroke. So heat stroke or sunstroke are other name of the LU. This is hyperthermia, and here sweating absent when the temperature of the body goes above 40.5 degrees centigrade. So this is hyperthermia. So this is heat stroke, sunstroke. Here sweating is absent, and this is hypothermia. That is a frostbite. This is a frostbite. Two different conditions. Frostbite is a hypothermia, and heat stroke and sunstroke is a hyperthermia. And my dear friend, in heat stroke and sunstroke, sweating is absent. So another very, very important image, my dear friend, that is, one is a moist burn, which is known as scald, and second is a dry burn, that is known as flame. My dear friend, scald is a burn when liquid or steam below. Scald is a burn where liquid or steam is above 60 degrees centigrade. And my dear friend, here skin has sodening and bleaching. So be careful, my dear friend. Scald is a moist burn. Liquid or steam above 60 degrees is scald, and here skin will be sodening or bleaching. But if you see the flame burn, in flame burn, it's a dry burn. Here we see the blackening or burning of the skin. That's a flame burn. And when do you start feeling burn? You start feeling burn at 44 degrees centigrade. So three important question. If sodening of the skin, if bleaching of the skin, these are given in the image, that will be scald, more than 60 degree. It's a moist burn. But when the blackening and singeing, burning, blackening, burning or singeing of hair is given, it is a flame burn. Yes. Dry burn. Now, my dear friend, this is a very, very important image of pugilistic attitude. And friends, pugilistic attitude is also known as boxing attitude. It is seen in burn, and this burn can be antemortem burn or postmortem burn. So I would say, is it a specific finding? No, my dear friend. It is a non-specific finding of burn, because it can be seen in antemortem or it can be seen in postmortem, both burn. What is the mechanism? The mechanism is coagulation of muscle protein. And if you get a question, what is the most characteristic finding of antemortem burn? The answer will be soot particle in trachea. So what are the question you can get in exam? If you have this coagulation of muscle protein, this is pugilistic attitude, boxing attitude or fencing attitude. Is it seen in antemortem, postmortem? Yes, my dear friend, it is seen in both burn. And it is non-specific finding. But if you get a question, what is the most characteristic finding of antemortem burn? The answer will be soot particle in trachea. Soot particle in trachea indicate it's an antemortem burn. Now, sir, After this, there's a very, very important finding which is known as heat rupture. Heat rupture. What is heat rupture? It is a rupture of skin and joint. You can see this is heat rupture. Here in the rupture, the base is pale, blood vessels and nerves are intact. So if you have a rupture and the base is pale and the blood vessel or nerve are intact, that is a heat rupture. The margin may be regular and margin may be irregular. If the margin are irregular, it look like laceration, and if the margin are regular, it look like incision. So sometimes it gives you a different picture. It is a heat rupture. It is caused by burn, but it look like laceration. But sir, how to identify this? Here the base is pale, first question, and the blood vessels and nerves are intact, which is not seen in laceration. So this very, very important finding is heat rupture. So this is the rupture which is known as heat rupture. Now, sir, we are coming to a very, very important burn, that is the electrocution. Friends, few questions you can get in electrocution. There is a burn which is known as joule burn. This joule burn is an entry burn. And my dear friend, this joule burn is seen when the low voltage and firm contact is there. When you have the low voltage and firm contact, that is a joule burn. My dear friend, it is a crater shape. It is a crater shape and the base is pale. This is a joule burn. And how to remember J for Jhatka, J for joule burn. But just remember one concept, low voltage and firm contact. Which is the highest resistance structure for electrocution? The answer will be, that is a dry skin. The second structure will be bone. Dry skin is the most resistant and the second will be bone. So again, I am coming to a very important point. If you have the crater shape depression, low voltage, firm contact, this is a joule burn of this. But sir, if it is a high voltage and loose contact, that will be a multiple pitted burn. This picture shows it's a crocodile burn mark. But how to differentiate? Low voltage firm contact joule burn, high voltage loose contact and multiple pitted burn mark, it is a crocodile burn. Just remember this concept also. Now sir, I am coming to the lightning injury, because you can get this picture in your exam. Lightning injury, how to remember? My dear friend, lightning in Hindi is known as bijli. तो आप पे अगर बिजली गिर गई, बिजली fall. So F for filigree burn, A for arborescent burn, L for Lichtenberg burn. So bijli fall on your body as a kiran, that is a keranographic burn. So how to remember? Lighting is a bijli fall, F for filigree, A for arborescent, L for Lichtenberg, and kiran is a keranographic burn. My dear friend, these are having branching tree pattern, branches of the leaves pattern. These are pink, these are erythematous, and my dear friend, these are because of RBC hemolysis or RBC degeneration. These do not correspond to the blood vessels, and air compression always goes in front. So that is a very, very important burn, that is lightning. So I have come to three conclusions. The first is low voltage and firm contact causes crater shaped joule burn. Second, high voltage and loose contact causes crocodile burn, multiple pitted mark. And my dear friend, very, very important, bijli giri, bijli fall, lightning burn, F for filigree burn, A for arborescent burn, L for Lichtenberg, and kiran for keranographic burn. These are the lightning burn. These are branches of the leaf pattern, my dear friend. Denaturation of the RBC, air compression is always in front, my dear friend. These do not correspond to the blood vessels. Dr. Sir, this is above dura. This is epidural hematoma, and this is due to rupture of middle meningeal artery. And it is exclusively traumatic. And if you see, it is biconvex. Subdural hematoma is concave or convex, but epidural is biconvex. And it is hitting on the pterion. That's question comes in exam. It is hitting on the pterion part, this pterion part, where four bones meet. This is epidural hematoma. You can get one more question. Lucid interval is seen in this, and medical negligence charges are very, very common in epidural hematoma. Lucid interval and medical negligence charges. Now, sir, this is biconvex. This is epidural hematoma. Middle meningeal artery, pterion, and you can see it is biconvex. Now, sir, if it is white in color, that is acute. And if it is dark in color, it would be chronic. That's a very important point. Now, sir, I am coming to injury one by one. Abrasion. Abrasion is a superficial injury of epidermis. This is an injury of epidermis, and this abrasion is a scratch abrasion, that is by nail or thorn. So any abrasion by nail or thorn is a scratch abrasion. Very, very important. It's a superficial injury. It is caused by nail or thorn or any pointed object. That is a scratch abrasion. Now, sir, grazed abrasion. If you are sliding on the road, or your body is grazed, that's a grazed abrasion. This question comes in exam. This is also known as brush burn, and it is very, very common in road traffic accident. This is a grazed abrasion. So I have discussed abrasion is a superficial injury of epidermis. The first was scratch and the second is grazed. Remember, my dear friend, frostbite is a hypothermia, not a bite. Same, brush burn is not a burn. Brush burn is an example of grazed abrasion. Don't get confused. Ligature mark, and you can say one more, that is a bite mark. These are the example of pressure abrasion. The ligature mark can be patterned also, but better answer is pressure. The ligature mark can be patterned also, but the better answer is pressure. So ligature mark and bite mark are example of pressure abrasion, especially in hanging cases. Tire mark, my dear friend, because it is making imprint of the object. So tire mark are the example of imprint or patterned abrasion, because it is making the imprint or pattern of the object. So I have discussed 4 abrasion. Scratch is by pointed object. Grazed is by, most common abrasion is grazed abrasion in road traffic accident. That is a brush burn. And the third is pressure, hanging ligature mark or bite mark. And tire mark are example of imprint or patterned abrasion. Now, raccoon sign, my dear friend, my favorite question. Raccoon sign is a migratory or ectopic bruise. Raccoon sign is a migratory or ectopic bruise. Here, fracture of anterior cranial fossa, and you have peri-orbital bruise. It is also known as panda eye. It is also known as panda eye. That is a raccoon sign. So a spectacle eye, panda eye, this is not a normal bruise. It's an ectopic or migratory bruise. You have fracture at the anterior cranial fossa, but the bruise is surrounding the orbit. That is a raccoon sign. But my dear friend, one very, very important example of ectopic bruise is battle sign. And we all know that battle is in Medan. Battle क्या होता है बेटा? युद्ध. So battle is in Medan. So that trick is very simple. M for Medan. M for it's a middle cranial fossa fracture, and a bruise is M for at mastoid area. That's a posterior auricular area. So it is also an example of ectopic or migratory bruise. So battle is always in the Medan. M for Medan. M for middle cranial fossa fracture. M for mastoid bruise. So this is a very important sign. That is a battle sign. Battle is always in the Medan. M for Medan, M for middle cranial fossa fracture, and M for bruise is at mastoid area. It is a ectopic bruise. Now, sir, by lathi or rod, very important question comes in exam. By lathi or rod, we have patterned bruise. My dear friend, it is also known as tram line or railway line bruise. So this is tram line or railway line bruise is by lathi or by rod. It's a pattern bruise. Friends, my dear friends, 6 penny bruise are coin-shaped bruise that is seen in throttling. This is also a pattern bruise. 6 penny bruise that is seen in throttling. Pinching the baby produces butterfly bruise. That is a butterfly shaped bruise is caused by pinching the baby. Now, sir, the bruise has brown color because of hemocedrine, and the green color is because of biliverdin. So these are few very important questions. I have mentioned 3 pattern bruise. Number 1, lathi or rod. That's a railway line or tram line bruise. Pinching the baby. That is pinching the baby. That is a butterfly bruise. And throttling produces 6 penny bruise. The color of the bruise, brown color, is because of hemocedrine, and the green color is because of biliverdin. All the question comes in exam. Now, sir, one of the very, very important example is split laceration. Friends, split laceration is seen on the hard surface. Like, what are the hard surfaces on the body? This is split laceration. Like you can see scalp, forehead, eyebrow, chin, like posterior part of the elbow, iliac crest, perineum. These are the hard surface. There is a split laceration because the surface is hard and the weapon is also hard. So if it is my hard surface and I'm using a hard weapon like a stone, there will be a split laceration because it look like incision. It is known as incised looking laceration. That is known as split laceration. Now, Dr. Saab, in laceration, how to identify? We'll get the crush. So this is known as split laceration. So it is by hard surface and by hard weapon. And how to identify this? You will identify the split laceration by crushed blood vessels and crushed hair bulb. So you have two important features, crushed blood vessels and crushed hair bulb you will identify. But it is on the hard surface, the weapon is hard, so there will be incision looking laceration. And you can see one very important thing, that's a swallowtail in the laceration. So I'm coming to a very important point. Split laceration is on which surface? Hard surface. Weapon is hard. Look like incision. How to identify? Crushed hair bulb and crushed blood vessels, and there is a swallowtail. If you get a question in laceration, we see swallowtail. Okay, this is very, very important. Now, sir, the second important laceration is a separation. It is also known as shearing laceration. My dear friend, this is known as avulsion. So, avulsion is a shearing laceration. It is caused by rotational force. This is avulsion or shearing laceration. Just remember one important concept. Here I told you the swallowtail is seen in laceration, but fishtail, it is seen in stab injury, and swallowtail is seen in laceration. Don't get confused. Fishtail is seen in stab injury and swallowtail is seen in laceration. So I am coming to two important one. Split laceration in on hard surface. It is incised looking laceration. How to identify laceration? Crushed hair bulb and crushed blood vessels, and there is a swallowtail. But if you see this one, that is a separation, it is a avulsion, it is by rotational force. Mostly it is by rotational force. Fishtailing is seen in stab injury and swallowtail is seen in laceration. Now, sir, incised wound. My dear friend, incised is a cut injury. If you see, the incised is a cut injury with tailing at the end point. The collagen fiber in the incised wound, see third letter, it appears in 3 to 5 days. And my dear friend, here length is maximum. And fibroblast in incised wound appears in 48 to 72 hours. Two questions, fibroblast 48 to 72 hours, collagen fiber 3 to 5 days. At the end point, you have tailing. So this is the tailing. This is the tailing. Tailing is always at the end point, maximum dimension is length. But sir, I told you split laceration on the hard surface is known as incised looking laceration. But one very, very important concept, my dear friend, two area in the body, that is axilla and scrotum, where incised is looking like laceration. That is known as laceration looking incised, because in these area, the margins are irregular. So two questions I'm putting again. First question, what are the area where you have incised looking laceration? That is a hard surface. Incised looking laceration is known as split laceration. Now, the second concept, what are the area where you have laceration looking incised? That is axilla and scrotum. And my dear friend, here length is maximum. So be careful, my dear friend. This is very, very important concept. Axilla and scrotum are two areas where laceration looking incision are seen. Now, if you have self-inflicted multiple wound, these are superficial in nature. First question. These are superficial in nature. These are three very important terminology given: hesitational cut, tentative cut, trial cut, and I can use one more word, that is an intentional cut. So these are mainly seen on the wrist, some part of the neck, like flexor part of the forearm. These are very common. These are suicidal wound. Dr. Sahab, these are self-inflicted. If other person hit you with your consent, that is a self-suffered. See, if I hit my body, that is a self-inflicted. But if I say someone to hit my body, that is a self-suffered. But anyways, multiple superficial suicidal self-inflicted wound are hesitational cut, tentative cut, trial cut, or intentional cut, which are suicidal in nature. Now, sir, in stab injury, the maximum dimension is depth. In stab injury, the maximum dimension is depth. You can see this is a stab injury. In Japan, there is a suicide by stab injury. They use a sword and hitting on the abdomen. You can get this picture also in exam. There's hitting on the sword. That method is known as harakiri. Harakiri. So if you get a question, harakiri is a method in Japan where hitting of the sword on the abdomen, that will cause cardiac collapse. The cause of death is cardiac collapse. So this is a very, very important concept. In Japan, we have harakiri, a suicidal method, which is a sword is hit on the abdomen. Stab maximum dimension is depth. Now, sir, this question comes in exam. The line of Langer, two questions you can get in an exam. That line of Langer correspond to the collagen fiber. Line of Langer correspond to the collagen fiber, and this decides the shape of the stab injury. This decides the shape of the stab injury. Remember, my dear friend, what is line of Langer? It is for shape of the stab injury. What does it correspond? It corresponds to the collagen fiber. So you can get this image in an exam. This is line of Langer. In stab injury, what is maximum? Depth is maximum. In Japan, harakiri, what they do? That hitting of the sword on the abdomen. What is the cause of death? Cardiac collapse. Yes. Self-inflicted multiple superficial wound are, that is hesitational cut. Very, very important. Incised wound fibroblast appears 48 to 72 hours and collagen fiber 3 to 5 days. Now, two important question again. What are the area where you have laceration looking incision? That is axilla and scrotum. And what are the area where inside looking laceration are seen? That is a hard surface. That is a hard surface. So, tardive spots, my dear friend, tardive spots are actually a petechial hemorrhage seen in the asphyxial death due to lack of oxygen supply. The venules are ruptures, the capillaries are ruptured. These are known as tardive spot. वैसे इसको ऐसे भी याद कर सकते हो, ताड़ने वाले स्पॉट आपकी आंखों में होते हैं. So tardive spots are common in the eyes, skin and mucous membrane of the area. That is asphyxial death finding. Now, sir, I am coming to a very, very important word. That is a case of hanging. My dear friend, hangman knot. Where do we put the hangman knot? In India, that is on the left side at the angle of mandible. What is the ideal or best side? Below chin. My dear friend, after dissection of the ligature mark in hanging, there will be a pale and glistening area. We have a hangman fracture of C2 vertebra. We have a carotid tear, which is known as MUSET sign. 5 line I have told you. If after dissection, you have pale and glistening area, mostly you have an oblique mark. Hangman fracture is seen of the C2 vertebra, and sudden drop that will cause MUSET sign in judicial hanging. Now, sir, antemortem hanging, the most characteristic finding is dribbling of saliva, and it is seen on the opposite side of the knot due to stimulation of pterygopalatine ganglion. So if my knot is here, the dribbling of saliva will be seen here. So that is the most characteristic finding of antemortem hanging is dribbling of saliva. The second most characteristic finding of antemortem hanging is la facies sympatheticae. What is la facies sympatheticae? It is a cervical sympathetic chain stimulation. It is on the same side of the knot, eye remain open and pupil is dilated. On the same side of knot, eye remain open and pupil is dilated. This is la facies sympatheticae. So this slide is very important. Hangman fracture C2 vertebra. MUSET sign judicial hanging carotid tear. After dissection of hanging mark, we get the pale and glistening area. And two very important questions. What are the two characteristic finding of antemortem hanging? The most characteristic is dribbling of saliva on the opposite side of the knot, and on the same side of the knot, eye remain open and pupil is dilated, which is known as la facies sympatheticae. As I told you, in hanging, we have parchment-like mark. That is when we dissect the mark, we get the white and glistening area. So this is a parchment-like mark, pale white and glistening mark, and after dissection, we get the pale and glistening area. That is a very, very important finding of hanging. The postmortem finding of hanging. So how to get, we decide it is hanging. It's a pale, white, glistening, parchment-like mark, and after dissection, we get pale and glistening area. Now, sir, garroting, my dear friend. Garroting is a judicial strangulation, and it is very, very common in Spain and Turkey. So if you get this picture, in India, we have judicial hanging, but garroting is a judicial strangulation that is very, very common in Spain and Turkey. Is it clear, my dear friend? Yes or no? Yes, garroting. So the next very, very important image is ligature strangulation. Friends, here as you can see, we have transverse ligature mark, and thyroid cartilage fracture is most common in ligature strangulation. So there will be, like we see the transverse ligature mark, thyroid cartilage fracture, and after dissection you will see contusion or hematoma. So hematoma beneath the neck structure that is found in ligature strangulation. Now in throttling, you can see the multiple bruises over the neck. And my dear friend, here hyoid bone fracture is most common. So hyoid bone fracture is most common in throttling, and thyroid cartilage fracture is most common in ligature strangulations. So if you see the multiple bruising and the asphyxial sign, it is throttling. It is throttling. Friends, smothering. Now, the multiple bruises over the neck, hematoma, that is a throttling, but multiple bruises on the face and lips and mouth. And after dissection, you have hematoma or hemorrhage. This is smothering. This is smothering, my dear friend. So this is smothering. Now, what is burking? Burking is a homicidal method, and it's a combination of two things. Number one, smothering, and number two, traumatic asphyxia. It is always homicidal in nature. So this picture is of burking. What is gagging? The cloth piece in the oropharynx, it is known as gagging. And my dear friend, it is homicidal in nature. So what is burking? Burking is smothering plus traumatic asphyxia. This is burking. Now, cadaveric spasm, my dear friend, it is due to ATP depletion, and it is most characteristic finding of antemortem drowning. Antemortem drowning, the most characteristic finding is cadaveric spasm. It involves a group of muscles, especially the hand muscles, and it is a very, very characteristic finding of antemortem drowning, because this cadaveric spasm is a antemortem event. Washerwoman hand, my dear friend, washerwoman hand is a non-specific finding that can be seen in antemortem as well as postmortem drowning both. But my dear friend, if you see white leathery mucoid froth, yes my dear friend, white leathery mucoid froth from the mouth, this is characteristic of antemortem drowning. So washerwoman hand can be seen in antemortem plus postmortem drowning, but white leathery mucoid froth, this is characteristic finding of antemortem drowning. What are the other finding of antemortem drowning? As you can see, water in GI tract, mud particle in trachea, and diatoms in bone. Diatoms are actually unicellular algae which can present in your body after drowning. So diatoms are very important for antemortem drowning. Pult-off hemorrhage. How would you remember that pult-off hemorrhage? P for pult-off hemorrhage, P for pulmonary hemorrhage. It's a subpleural hemorrhage seen in the drowning. So there are multiple subpleural hemorrhage. Pult-off hemorrhage are characteristic feature of drowning. P pult-off, P pulmonary hemorrhage. Now, sir, I am coming to two words. The study of death is known as thanatology, and study of postmortem change is known as taphonomy. Two different words. Study of death is thanatology and study of postmortem change is taphonomy. Now, sir, I am coming to eye changes after death. The first eye change, you can see the potassium increases in the vitreous humor, but the earliest eye change is Kevorkian sign. You can see this picture. The Kevorkian sign or railroad sign or cattle trucking sign are the eye sign, where the retinal vessels are fragmented or segmented. So this sign is the earliest eye sign, that is a Kevorkian railroad or cattle trucking sign. Potassium also increases this in vitreous humor. This is Kevorkian sign, a very, very important. Now, the next very, very important image is tachynoir of the sclera. This is seen almost 3 to 6 hours after death. It's a triangular change. And my dear friend, T for tachynoir, T for 3 to 6 hours, T for triangular change. Algar mortis is decrease in the temperature after death, and especially we take the temperature of rectum. But anyways, this is the image of tachynoir. Postmortem staining, what are the other name? Postmortem lividity, hypostasis, vibices, sugillation or liver mortis. My dear friend, these are 6 names: postmortem staining, postmortem lividity, hypostasis, vibices, sugillation. Friends, you can get these are seen in the dependent part of the body. These are absent from the pressure area. And what is the mechanism? The mechanism of postmortem staining is pulling off the blood in capillary and venules. Because of deoxyhemoglobin, the skin become bluish purple. This is postmortem staining. And my dear friends, especially in the layer of dermis, which is retimucosum. So this is a very important, seen in the dependent part, absent in the pressure area. This is postmortem staining. Yes. Now, in the supine position, the postmortem staining will be present on the back. If your body is in prone position, the staining will be seen in front. In moving body, the staining will be absent. And in hanging body, it is seen in glove and stocking pattern. So this is a very, very important part. It decides the time since death and position of the death. If you see what is the position of the body, what is the time since death, these all are decided by postmortem staining. So another very, very important slide is postmortem staining. Now, friends, the next slide is rigor mortis. As I told you, the cadaveric spasm is because of ATP depletion. The rigor mortis is again because of ATP depletion. The first muscle where rigor mortis is seen is myocardium, but first external muscle is upper eyelid. Friends, one question comes in exam. Rigor mortis from head to toe. This law is known as Nisten law. The rigor mortis progresses from head to toe. This is a Nisten law. As I told you, cadaveric spasm is again due to ATP depletion. It is specific group of muscle, like especially hand. Here, it is just after death. That's why primary relaxation phase in cadaveric spasm is absent. In rigor mortis, it takes some time. The primary relaxation phase is present. Marbling, my dear friend. What is marbling? Marbling is your superficial vein become prominent. And it starts in, if you see, in 24 hours, and maximum it is seen in 36 to 48 hours. Especially in the area of the thigh, chest, abdomen, it is very common. Now, sir, this is marbling. The first sign of decomposition is greenish discoloration of right iliac fossa because of sulfa hemoglobin. The last organ to be decomposed in male is prostate, and in female it is non-gravid uterus. But if male and female are not asked, then you will keep the answer bone or teeth. Okay, so these are some questions of the decomposition, but this picture is marbling starts in 24 hours. Again, the pigment responsible is sulfa hemoglobin. Maximum marbling is seen in 36 to 48 hours. Sir, I already discussed a very important difference between like what is filigree burn or like lightning burn. But if you see the comparison, filigree burn or lightning burn are pinkish in color. But sir, here you can see the mechanism of marbling. It is greenish brown in color. It is because of one bacteria, Clostridium welchi, and it is because of sulfa hemoglobin. As I told you, it starts in 24 hours. Maximum it is in 36 to 48 hours. My dear friend, one very important difference is that lightning doesn't correspond to the blood vessels, but marbling, that is a superficial vein prominence, it corresponds to the blood vessels. So this is very important picture, and I already told you the lightnings are branches of leaves pattern. Yes. Sir, these are the maggots which are larvae of the fly. Generally, maggots are seen in 1 to 2 days. Rainy season, it comes very early, and the study of maggots are known as entomology. If you see the maggot cycle, my dear friend, these are the larvae of flies. And these flies are Musca domestica and Musca vicinia. My dear friend, in the summer season, the whole cycle is 5 to 10 days. And in winter, the whole cycle of the fly is 8 to 20 days. Now you can see maggots in 1 to 2 days, then pupa in 3 to 6 days, and adult in next 3 to 6 days. So it is also very important criteria to decide time since death. Adipocere, A for adipocere, A for it is a ammonical smell, my dear friend. And in fetus below 7 months of age, the adipocere is absent. It's ammonical smell. It is seen in warm and humid climate. So I am coming to this very, very important concept, my dear friend. It is having ammonical smell. Friends, it is showing a pseudo smell because the smell goes in your clothes. It is a pseudo smell. Adipocere is fresh, soft, moist, and white, fresh, and old is dry, hard, and brittle. The time for adipocere is 3 days to 3 months, and in the fetus below 7 months, it is absent. Listen one thing very carefully. A for adipocere, A for ammonical smell, and it is seen in warm and humid climate. Adipocere is a very, very important phenomena seen in warm and humid climate. Again, the responsible bacteria is Clostridium welchi, but the enzyme is lipase, not lecithinase. Mummification is also known as desiccation. It's a dehydration. The smell is odorless. The smell of adipocere was very pungent, offensive smell, but it is odorless. In adipocere, the climate was warm and humid. Here we have dry and hot climate. Natural feature of the mummified body are preserved. The body weight is lost, my dear friend. The time is 3 months to 12 months for mummification to develop. And arsenic and antimony favors mummification. Arsenic and antimony favors mummification. Now, sir, I am coming to this very important toxicological image, that is strychnine. A very, very important image, strychnine. What are the other name of strychnine? That is Nux vomica, Cuchilla, and dog button. The fatal dose of strychnine is 1 crushed seed and the seed are concave or convex. Sir, it acts on the anterior horn cell of the spinal cord. It mimics a disease tetanus, and I am expecting this question that it acts on the postsynaptic receptor cells, inhibits the glycine. And very important finding, we have hyperextension of the back, which is known as opisthotonus. So this is strychnine, nux vomica, cuchilla, and dog button. 1 crushed seed is a fatal dose. Tetanus it mimics, and postsynaptic inhibition, Renshaw cell, that is a very important glycine inhibition. This is Ricinus communis, that is a castor plant or R&D. My dear friend, the fatal dose are almost 10 seed. Ricin is the toxalbumine, which is very, very dangerous one. Ricin. So it is again a plant irritant. The strychnine was spinal cord poison. It is a plant irritant, organic plant irritant. So you can see the fatal dose are 10 seeds. It is a castor plant or R&D. As I told you, the toxalbumine is ricin, my dear friend. Its mechanism is it inhibits R4 ricin, R4 it inhibits RNA polymerase. And my dear friend, any toxalbumine which is present in the organic irritant plant, they cause RBC agglutination. Very, very important, my dear friend. And it is a category B biological warfare agent. So this is a castor plant. R&D, you can get the picture of this plant. There is a small shiny seeds. That is a smooth one. This is the rough one, that is a croton. And my dear friend, it is also known as Napala or Jamal Ghota. The fatal dose is 4 seeds. So listen, my dear friend, strychnine fatal dose was 1 crushed seed. Castor or Ricinus was 10 seed. It is croton, Napala or Jamal Ghota, 4 seeds. You can see it is Jamal Ghota or Napala. Here the active principle is crotin. And it is a strong purgative. That is a croton is a strong purgative. So this is croton tigilium, Napala or Jamal Ghota. You just please, this is a very, very important, my dear friend, Abrus precatorius. It is a ideal cattle poison. The first line written is ideal cattle poison because we make sui or a needle and hit on the animals. And my dear friend, these are the scarlet red seed with black tip. It is known as Ratti, rosary bead, Abrus, and one question always comes in exam that Abrine mechanism is just like a viper venom. So if you get a question, which plant organic irritant is same like a viper venom, the answer is Abrus. This is Abrus precatorius. This is another very, very potential MCQ, the semicarpus anacardium, which is also known as marking nut. Here the seed are heart-shaped, and one very important question I have seen in exam, the Bhilava is a toxic principle. So, because it is known as a Bhilavanol or Bhilavanol and semicarpol are two very important toxic principle of semicarpus anacardium. Heart-shaped seed, my dear friend. You can see the heart-shaped seed, it is semicarpus. So, you can see it is also known as marking nut. As I told you, Bhilava is a plant. Two principal are semicarpol or Bhilavanol. One question, artificial bruise it causes. Painful blister it causes. In cloth it is used as a marking. So it's known as a marking nut. Fatal dose is 5 to 10 gram. That is a very, very important plant, semicarpus. Now this is none other than Calotropis, Hakdo, Madar or rubber bush. Rubber bush. The active principle is Uscharin. So Akdo, rubber bush, Madar or Calotropis all are same. So you can see Calotropis gigantea is a purple and Procera is a white Calotropis. My dear friend, what are the active principle? Calotropin, calotoxin, calcatine, but one is very important which I already mentioned, Uscharin. So you can remember this by ABCD it causes, accidental poisoning it causes, artificial bruise it causes, cattle poison it is, and dilated pupil are seen in Calotropis. So it is used for conjunctivitis, malingering and convulsion it causes, that is a Calotropis. Very, very important. This is, my dear friend, a very, very important word, that is thorn apple, Dhatura stramonium, which is anticholinergic. Fatal dose is almost 100 to 125 seeds and it is active principle is hyoscine. My dear friend, this is a thorn apple and these are Dhatura seed. It is a deliriant poison. If you know, there are three deliriant poison, the CCD, cafe coffee day, that's a cocaine, cannabis and Dhatura. It is most commonly used as a railway or roadside poison. It is an anticholinergic plant. So antidote is physostigmine. For any anticholinergic plant like Dhatura, like Atropa belladonna, we use that physostigmine. And Oxav, it is a 9D poison, dryness, drunkenness, diplopia. There are so many D in Dhatura. And one question also comes in exam like hot as a hair, like these are 5 things which are given and you can get a Dhatura in answer. So if many symptoms are given, 9 Ds are given, that answer mad as a hen, you can get a very important one, Dhatura. That's a thorn apple. These are C, H, chili seed, C for capsicum, H for Hunan hand, which is a dermatitis caused by chili seed. C, capsicum, H, Hunan hand. Sir, these are Lepidi group. I'm coming to a very important snake category, that's a neurotoxic. So this question I have seen in exam recent in INI-CET, the Lepidi are neurotoxic. And this is king cobra and this is cobra. How to identify cobra? By spectacle. By spectacle. Now both are neurotoxic. And common karit, which is a Bengarus, here it is also neurotoxic. And my dear friend, the cause of death in neurotoxic snake is RMP, that is a respiratory muscle paralysis. In cobra, we give neostigmine and atropine along with anti-snake venom. But here in karit, no neostigmine, no atropine. It is only ASV plus mechanical ventilation. In all these neurotoxic snake, the cause of death is respiratory muscle paralysis. V for viper, V for vasculotoxic. So very common symptom is bleeding. And how to identify this Russell viper? There are 3 rows of brown spot which are diamond shaped, 1 row on the top and the 2 row on the lateral side. So this is Russell viper, a very, very important vasculotoxic snake, my dear friend. Bleeding is there and we can control the bleeding by fresh frozen plasma, and anti-snake venom is also given and surgical debridement is also done. That is a Russell viper. Now that was a 3 brown row scale, my dear friend. It is a saw scale viper. It's a angulated scale and coiled around viper. It's a saw scale viper. But sir, as for sea snake, as for it act on the skeletal muscle, so I would say it is a myotoxic. And also how it causes myotoxicity? Because of muscle necrosis, it releases myoglobulin and causes renal failure. You can get a question, what is the cause of death in sea snake poisoning? The answer is renal failure. And you can see the flat tail which is used in paddling and it causes rhabdomyolysis. So neurotoxic are Lepidi, cobra, king cobra and common karit. The vasculotoxic is Russell viper and the sea snake is myotoxic. Python causes traumatic asphyxia because it causes like python causes, like you can see, it's a kind of asphyxia it causes. Python. Are yes or no? So that is a very important mechanical asphyxia, you would say. That is not traumatic. Python traps you, that it causes mechanical asphyxia. Is it clear, beta? Chest fixation is a very common cause of death. Python is very important, causes chest fixation. Now, sir, this is a very, very important image. That's a blister beetle. So this is very, very important image. Blister beetle, which is a Spanish fly. It causes canthroid poisoning and priapism. Canthroid poisoning and priapism. Doctor sir, this is a very important image of a body which is a Davidson body present in 6% female in neutrophil. And this is drumstick shape. I'm putting one question of the microbiology. The drumstick bacteria is Clostridium tetani and drumstick body is Davidson. So you can remember D for Davidson, D for drumstick, N for it is present in neutrophil. That is present in female. Now dental charting, my dear friend. The first method is Palmer notation or Zsigmondy method. In dental charting, the first method is Palmer notation or Zsigmondy method. We have 4 quadrant, right upper, right lower, left upper, left lower. And if I am writing the teeth as a number that is 1 to 8, that is a Palmer notation in Zsigmondy method. This question was recently asked in INI-CET exam. So 1 to 8 and 1 to 8 are given. That's a Palmer notation. This is for permanent 1 to 8. For temporary, we don't give word 1 to 8. We give A, B, C, D, E, A, B, C, D, E. This is Palmer notation or Zsigmondy method. But sir, if along with upper teeth, we write down plus, and for lower teeth, we write down minus. That will be a head-rough formula. So if plus minus symbol are given, that will be a head-rough formula. 1 to 8, 1 to 8 is a Palmer notation or Zygmundi. 1 to 32, 1 to 32 will be different method, but plus minus will be a head-rough formula. If the number are given 1 to 32, that is a universal or Cunningham methods. You can see. So here the number is not 1 to 8, that is 1 to 32. It is a universal or Cunningham method. Yes, my dear friend, for temporary teeth, we don't use the number, we use the letter, my dear friend. That is from A we start. Again, I am telling you, my dear friend, 1 to 8, 1 to 8, that's a Palmer notation or Zygmundi. Very simple one. Plus and minus head-rough, and 1 to 32, it's a universal or Cunningham method. Now, sir, I am coming to FDI formula. What is FDI? Federation Dental International. Here what we do, we divide the 4 quadrant as a number. First, second, third, fourth. If it is a first, in 1 to 8, I will add first. So it will be 1, 1, 2, 1, 8. In second quadrant, I will add 2 in every tooth. That is 2, 1, 2, 2, 8. Very simple. This is third quadrant, 3, 1, 2, 3, 8. Yes. And this is fourth quadrant, 4, 1, 2, 4, 8. If I do like this, this is known as FDI formula. What I am doing, it is 1 to 8, 1 to 8. But I am adding first quadrant 1 I'll add, second quadrant 2 I'll add, third quadrant 3 I'll add, fourth quadrant 4 I'll add. This is FDI. But sir, if I change the quadrant in FDI, what was the number of quadrant? 1, 2, 3, 4. But if I change the number 1, 2, 4, 3 in FDI, 1, 2, 3, 4. If I change 1, 2, 4, 3, that will be a modified FDI. So again, I am revising all 5 dental formula. 1 to 8, 1 to 8 is a Palmer notation. Upper teeth plus lower teeth minus head-rough. 1 to 32, universal or Cunningham. If I add the number of quadrant 1, 2, 3, 4 in 1 to 8, it's FDI. But if I add the number of quadrant 1, 2, 4, 3, it will be modified FDI. Yes. Sir, now I am coming to the dactylography, sir. This is loop. This is the most common type of fingerprint. Here you have one delta and one core. What is a core and what is a delta? Delta is a meeting point from 3 sides. Yes. And core is a convergence. If the papillary ridges come towards each other, it is core, and 3 side meeting point is a delta. So you can see here we have one core and one delta. This is the most common fingerprint, loop. The second fingerprint is arch. Here no core, no delta. And the third is looking like a circle, that's a whorl. Here 1 to 2 core and 2 delta. So just remember which is the most common type of fingerprint, loop variety. Which is the least common type of fingerprint, composite, which is a mixed pattern. In loop variety, we have one core and one delta. In arch, which is just like a mountain, it is no core and no delta. And in whorl variety, it is 1 to 2 core and 2 delta. Delta is a meeting point. You can see there are 2 meeting points. So this is a very important picture, comes in exam. That is a types of fingerprint. Now, the best method for criminal identification is fingerprint. Dactylography is also known as Galton system. First fingerprint bureau was established in Kolkata. Fetus fingerprint start in 12 weeks, completes in 24 weeks. Minimum how many points should be similar for fingerprint? That should be 10 to 12. Fingerprints are lost in leprosy, radiation and electric burn. And what are the variety of fingerprint? You can remember by love, wife and children. Love for loop, wife for whorl and for arch, and children is a mixed variety, composite variety. So my dear friend, this was all about some very, very important images of forensic medicine. Please go through these images and please do revise the LRR, which is for all exam, a very, very important things, my dear friend. So best wishes for your exam, for all exams, for FMGE exam, for NEET PG exam. Good luck. Goodbye.